Good. Well, a warm welcome to this video, and I am absolutely delighted to welcome Senator Rennick from the Australian Senate. Senator, thank you so much for making the time to come on to the video.
Thanks for having me on today, John, and it's a great pleasure to be here. And can I just congratulate you on all the excellent work that you've done over the last 18 months in raising concerns about the vaccine and the various risk reward potential involved with the vaccine.
And indeed, I've been following the work that you've been doing, and it really is quite brave, to say the least, the work that you've been doing. Now, we want to discuss this document here. This is from the TGA, the Therapeutic Goods Administration in Australia, which authorises therapeutics. It's called a non-clinical evaluation report, and it's on the Pfizer vaccine, and it's dated January 2021. So this is presumably just before the vaccines were approved in Australia, from my general background.
Yeah, that's correct.
Yeah. Now, first of all, there's some amazing things that you've pointed out in your analysis that I'd like to look at. Really quite startling, actually. I mean, if do make the time to watch this video, everyone, because there is some really amazing stuff in here that Senator Rennick has highlighted from this report. How come this report is in the public domain, first of all, Senator? Please?
Well, that's thanks to the work of a lady in Melbourne, actually, who put in a Freedom of Information request and clearly must have known what she was talking about, that actually asked for the actual non-clinical evaluation report. And so it was finally released after months of hassling, and they wanted to charge thousands originally to get this data released, and this particular lady was like a bulldog and just fought the TGA to get the data released. So it was finally released, the first draft, on the 15th of July 2021 with a number of other documents, and it's known as the 2389 series. And if you get on the Google TGA FOI log, you will see it if you scroll back down to the 15th of July. And this particular document we're looking at today is 2389-6.
Mm-hmm.
Yeah.
And we will put a link. You can download this full document. It runs to 58 pages.
Yeah, and there is a bit of an addendum to that, is that the lady who initially lodged the FOI, there was a large part of that document was initially redacted, and she kept fighting them, and she's finally got more of it unredacted in December 2022, 18 months later. And there's some very interesting data in there that was actually redacted the first time, which I think was negligent of the TGA not to actually release, so that people could make a fully formed choice as to what they were taking.
Mm-hmm. So I think it's clear to emphasise that the Therapeutics Goods Administration in Australia had all this information prior to authorising the vaccines, the COVID vaccines. This was known about. Now, the first point, you've raised quite a few points. Can we go through these?
Yeah, absolutely.
The point you've raised from page 4. Almost similar microscopic lung inflammation was observed in both challenged, control and immunised animals. So we're saying, what are we saying here? Do you want to unpack that a little bit for
Well,
us?
my understanding of that when I read it was that there didn't seem to be a lot of benefit from the vaccine in the immunised rats, and and I'm happy to be corrected on this. I'm not an expert, but it would appear to me that there wasn't a great deal of benefit from getting the vaccine in the first place, if I read that correctly.
I think you did, and this is in monkeys, so it's a fairly close human analogue, and it seems to be showing that the vaccines didn't show clinical improvement in animal studies. So why we would assume that there would be this improvement in humans is somewhat unclear. And the other thing here is that they didn't compare the antibody response between the vaccinated and the unvaccinated, which does seem like a bit of an omission. So, but in terms specifically of the lung damage, there didn't seem to be a great deal of difference between the vaccinated and the unvaccinated. The other point you made is page 4. About the distribution. There's no distribution and degradation data on the S antigen encoding. What was the concern there, Senator?
Well, I mean, this is obviously the first time that we've got a vaccine that uses mRNA to create a protein. I would have thought it would have been more than obvious to actually test the output of the vaccine. And in those animal trials, they used luciferase, which is a benign enzyme. But, as someone once described to me, that's like crossing a border, a truck crossing a border with fruit versus a truck crossing a border with explosives. It's the content inside, the mRNA. Well, it's what that mRNA encodes for. So obviously the question, they needed to test all the potential risks of that protein, and that can be, did it actually get secreted from the cell or did it stay in the cell membrane? Did the actual S protein travel throughout the body organs, and we'll get onto that later, without the lipid degrading in the first place before it even entered the cell, so that you've got mRNA actually inside the circulatory system before it even hits the cell. So that can be a problem in itself, or a potential problem. And then if then you've got the issue of, okay, well, let's just say it stayed on the membrane and induced an autoimmune response. How severe was that autoimmune response? Did it destroy the entire cell, or did it just destroy the bit on the cell membrane? And then if it did get secreted from the cell, how far did that spike protein travel? How long did it stay in the body for? Did it cause clotting? So these are all the questions that, we're putting this out across billions of people, that, people have a right to know what the impact of the so-called translation of the mRNA into the protein and the impacts of that on their body would have been.
And we do know that the data shows here, I've got this page here, that the systemic distribution is quite stunning. We were initially told that this just stays in the deltoid muscle. But here we see that the vaccine's actually been found in adipose tissue, adrenal glands, bladder, bone marrow, brain, eyes, heart, injection site, kidneys, large intestine, liver, lungs, basically all over the body. So they knew about this systemic distribution, that was there, and that was known about. And the other thing, we were told that the vaccine the mRNA would only stay there for a short period of time. But then we read from page 4 that there was actually no degradation data.
That's exactly right.
We're not told how quickly it would go away. Really quite incredible.
Yeah, so two big issues there. So some of the pushback I've had from the TGA in regards to that distribution is they're saying it's at levels that's not toxic to the body in the other cells, in the other body organs. Now, that may be true after 2 days, but the question is, why did they stop it after 2 days when the level of concentration in those organs was still increasing? I would have thought you would run the trial long enough so that the actual lipids and the mRNA and the spike protein was actually had left the body. So the question is, how long did those other body organs continue to increase in the lipids that then translate into the protein? And then, like you say, how long did it take, for the lipids, mRNA that didn't convert into proteins, and the proteins themselves, how long did it actually take for that to degrade and leave the body?
That's one of the things I found most concerning, really, that we were told that the mRNA will break down in a short period of time, but here it's saying that simply was not studied. So at the time this vaccine was approved, people simply didn't know how long it would last for. Another point I got from page 5 was that the antibody and T cell response that was present initially declined quite rapidly over 5 weeks. So it looks like the TGA knew that this would only last for a short period of time. Was that your reading?
Yeah, that's exactly my reading. And this is something else that they never made clear, is that they waited 3 weeks to even count you as being vaccinated after you were vaccinated. So for the first 3 weeks, you're counted as unvaccinated. So that leaves about 2 weeks of protection before its effectiveness, if you want to say it was effective, starts to wane anyway. So yet again, we go back to that initial data where there was very little difference in microscopic lung inflammation after day 8, day 9 versus such a short-term duration. And this is the thing, if you've got to take multiple shots of a vaccine to get protection, then you start bringing in other issues like, immune imprinting, any impacts on your immune system if you're constantly giving it repeated exposure to antibodies. To the vaccine.
To the vaccine, yeah. And another thing I noted from page 6, long-term immunity, vaccine-induced autoimmune disease were not studied. So we've got this risk. Well, it's not a risk. We now know that the TGA knew in January 2021 that there was systemic distribution of this vaccine. And yet it specifically says on page 6, long-term immunity, autoimmune diseases were not studied. I mean, how do we account for the fact that these things weren't studied? It just seems rather strange. How could there be so many omissions?
Well, yet again, and I mean, this you didn't need to read the TGA report to know this. It was also in the Pfizer documents, the original Pfizer documents, where they note that they didn't do long-term studies and toxicity studies, carcinogenic studies, etc., etc.
Yeah.
They will argue that, because, COVID was such a severe virus, they needed to roll it out quickly. Now, that may have been a fair point, depending on your point of view, but, two wrongs don't make a right, and taking shortcuts. And particularly, my issue was, so my particular circumstances were, I knew a little bit about biochemistry. I'd studied science for a year in my early 30s and had biotech stocks, and I've actually had a mRNA stock in Australia that eventually got taken over by Merck Roche. But so I had a little bit of a background, but I knew enough to know that because the coronavirus mutates very quickly, at best the vaccine might last one season before you end up with another strain of the flu. So, it was never going to provide really long protection, not necessarily because the vaccine was bad, but because the virus would mutate. The argument that, you can justify rolling out a vaccine so quickly, I always felt was a bit risky for something that, we were eventually going to have to learn to live with. But what we've now got, of course, is a lot of vaccine injuries. But so for the first, from January 2021, let's say November 2020, when just after Joe Biden got elected, and of course there are a few issues there. Just after Joe Biden was elected, we had three companies, pharmaceutical companies, come out and say they had a vaccine for coronavirus when in vaccine hadn't been created for the coronavirus in the last 40 years. And suddenly, within a matter of weeks, three companies had found a vaccine that works. Seemed quite astounding if you ask me. But anyway, I kept my mouth shut, knowing that, we needed to do something. But then around October 2021, I started getting contacted by a lot of young people who were getting severely injured by the vaccine, or, were getting injured in a matter of days after taking the vaccine. So there was a very strong temporal association between injuries and people taking the vaccine. Now, that, of course, is the red flag of all red flags, especially for young, fit, healthy people who had no prior symptoms suddenly getting ill. And what's particularly annoying is that the authorities have seemed to gaslight these injuries and haven't tied back the wide range of injuries back to, as we looked at page 45 of that document, the large number of, the fact that this vaccine does go into a large number of organs, which in theory at least, could explain the large number of injuries and the wider range of injuries, the different symptoms, resulting in myocarditis, neurological issues, skin disorders, people having issues with their eyes, etc., etc.
And one thing I did notice, page 12 to 14 of the document, it actually runs through specifically things that weren't done, which are really quite inexplicable. For example, there was no toxicity studies on the lipid nanoparticle formulation that was used. There was no secondary species toxicology. There was no genotoxicity on the DNA. There was no cardiogenicity studies to find if there was any cancer causing. There was no studies on reproductive activities. There was no studies on immunotoxicology. There was no juvenile pediatric studies. And it also included novel excipients, which are additional components in the vaccine as well. It actually specifically says that these things weren't done when we were absolutely promised by all our chief medical officers, at least in the UK, and everyone in the UK, that every step that was normally taken in a new vaccine was taken with this. It was just compressed. But now we've got a big list of things, at least in Australia, that were simply not done. Do you imagine that these omissions were potentially the same in other countries? Do you think this document is somehow unique to Australia?
Absolutely not. I mean, we purchased this vaccine from Pfizer, and it was actually manufactured overseas. So the only difference would be that in Australia it might take longer to get here, and you have to store at negative 70 degrees this particular vaccine, so it was a very fragile vaccine. But another key point to make here is that everyone, including the health experts, including politicians, were saying this vaccine was safe and effective. Now, they hadn't done enough trials to say that. Now, I've had, and I just note that you put up a prior video of mine in the past, and thank you for that. I've had
Indeed,
that.
yeah, thank you. Yeah.
I've had that video pulled down because it was deemed by social media when I posted it to be dangerous. And they're trying to pull another post of mine down when I said the vaccine was dangerous. And I said, well, actually, what's dangerous? I'm currently threatening to take Facebook to court. Is what's dangerous is when you say a vaccine is safe and effective, and you don't outline all of the risks involved with that vaccine, and all of the lack of safety testing that you didn't do with it. So, that to me is a massive issue. And and the key point about this vaccine is this wasn't a protein vaccine. You might have given it, given the urgency of COVID, you might have given it a bit of a pass, knowing that, we've got a good long history of protein vaccines. This is an mRNA vaccine. It uses a different pathway. It enters the cell. No other drug has ever done that. I mean, this is a whole new technology, and then they've rolled it out to, a large percentage of the human population, assuming that everyone's going to react the same. And now I've got a child who's, I have a son who's allergic to penicillin. Penicillin is a high therapeutic index. Most people are fine with it, but there are a small number of people who are allergic to penicillin. Every person is unique, and we have to listen to their concerns, especially if they've had prior anaphylactic reactions or reactions to other drugs. But yet here in Australia, we've had people who've got injured from the first vaccine, and they had to take that vaccine because their employer mandated it. They've been injured, and then they've got sacked anyway because they didn't take the second vaccine. So they were forced into choosing between their own health and their own survival and keeping their job. And when you read this document and you read the number of checks and balances that were missed, it in my view has been a gross violation of human rights.
And another thing that concerns me there, really, as an elected senator, you're an elected senator in Australia, and yet social media platforms decide that you can be censored when the people of Australia have elected you into your democratic position. It just seems a rather anomalous situation that we find ourselves in, unfortunately.
Yeah, we do. And, as the Twitter files have revealed, the White House leaned very heavily on social media companies not to promote so-called disinformation about the vaccines, and that's certainly not my intent. My intent, and I came from a finance background originally, but, in finance and when you're working with billions of dollars in Treasury, you've got to actually, minimise your downside risk. The first thing is to always minimise your downside risk. In health, there's an equivalent saying, do no harm. And, these rules have come in place over years because, we've got to protect the people. I just feel as though those guidelines have been completely trashed, in the last few years with this particular rollout of the vaccine.
Mm-hmm. Another point raised in the document was that the vaccine, the mRNA codon, has been optimized to improve antigen expression to make more spike protein. And the lipid nanoparticles will actually go into numerous body cells that the virus itself can't gain access into. So in a sense, that the virus has got a much smaller distribution in terms of the tissues it can infect than the vaccine itself has. So I hadn't thought of that before. It means they could be getting spike protein in any cell in the body potentially, whereas the virus would only affect fairly specific cells with the ACE receptor.
That's exactly right, John. And that particular information was on page 18 and page 19 of the document. Yeah. That information was originally redacted. And so we've only became aware of that last December. Now, that's incredibly important for a number of reasons. If the vaccine produces more spike protein than what the virus would, that goes against everything a vaccine normally did. A vaccine's normally attenuated, it's meant to be weaker, and you get a smaller dose, not a stronger dose. And because if you're getting a stronger dose, that's kind of counterproductive to the whole purpose of the vaccine. You're not getting greater protection, you're getting greater risk. And yet again, you have to ask yourself, well, is this does this qualify as gain of function research when you're injecting a vaccine that produces more of the antigen, not less? And then, so that's the codon optimization. And then you've got the transfection issue. So this is a process. Normally, a cell membrane requires enzymes and ion channels. So your cell membrane is set up. So, your body's made up of about 30 trillion cells, and each little cell is like a little country. You have a cell membrane, which is like a border and a border crossing.
Yep.
You'll have ribosomes, which are like your factories. They produce proteins. You have your mitochondria, which is like your power stations that provide oxygen and give you energy. You have your nucleus, which is like your little home, and that reproduces cells to create more cells. So your cell membrane, it'll have things like ion channels and receptors, and those receptors, depending on the organ, will let in certain types of molecules and not others. So what the coronavirus did was use the ACE2 receptor as well as the transmembrane serine protease enzyme to help get the virus across the membrane. What the vaccine did was bypass all of that and use transfection, where they slightly ionise one of the 4 lipids in the lipid nanoparticle to cross any cell membrane. Now, that made it much more infectious. So we've now got a vaccine that produces more proteins, antigens. It's more infectious because it can enter more cells, including cells that are involved with the immune system, the bone marrow, the lymph nodes, the spleen. And the question you have to ask yourself is, well, if we go back to that initial top of page 8, where you're either going to induce an autoimmune response or start exporting spike proteins from out of your immune driven organs, does that then impede the ability of the immune system to actually do its job and then go and destroy the virus or the antigens when you actually get coronavirus, because it's still fighting the impacts of the vaccine? And there's another thing that this document doesn't cover. The mRNA has a polytail, a poly-A tail. Normally that poly-A tail has about 30 adenine nucleotides, and that slowly gets eaten away over a period of time. And then when that poly-A tail is finally degraded, then the mRNA strand breaks down. This particular vaccine, they've added about another 70 adenine nucleotides so that your poly-A tail is about 3 times longer. So what that means is that the mRNA lasts 3 times longer, or about 3 times longer. It mightn't be quite that much, but it's a longer lasting mRNA than what's in the virus. So longer lasting, stronger, not weaker, and more infectious than the virus. Is this, this to me goes against everything that a normal vaccine should be doing. And add to that the biodistribution. So your normal coronavirus, I think, had 29 proteins or molecules. Proteins, sorry.
Yeah, maybe
about
proteins,
29,000, little nucleotides, sorry.
Nucleotides, yeah.
And so normally you would pull off the spike protein and be left with 28 proteins left. And that's too big to cross the endothelium to get into your capillaries, your blood capillaries. With this particular vaccine, they take the spike protein, i.e. one protein, it's therefore much smaller. It's easier to cross the endothelium, get into the blood capillaries, and then distribute throughout the body. So now we've got 4 things that increase the risk factor of the vaccine over the virus, which is biodistribution, infectivity, duration, and the toxicity in terms of how much spike protein it produces.
Yeah, absolutely. The amount of spike protein produced in you and me might be completely different, so the dose becomes completely unpredictable.
That's exactly right. Yeah.
Yeah.
And I think it's, if you go back to that 2389 series, it's either -2 or -3, where they talk about the number of doses in one vial. So one vial of the vaccine had 5 doses, and to administer it, you need to turn it up and down 10 times. You can't shake it too vigorously, or the mRNA will degrade. But this is something that's stored at -70 degrees. You can defrost it for a couple of days. But how do you know, when you've got 5 doses of 30 microns, that one person all 5 people that use that particular vial will get 30 microns of the dose? So what happens if one particular person got, say, 90 microns because the person was in a hurry? Because, as you know, there were lots of people getting the vaccine at one time. and that person happened to weigh 60 kilograms versus someone that's only got 10 microns and weighed 120 kilograms. So yet again, some people will be getting a lot more mRNA than others. It beggars belief that given that the risks involved with this vaccine, that they didn't have one dose per vial so that you could ensure an even distribution of the mRNA or the lipid nanoparticle encased mRNA per person.
And another thing that I found quite staggering was that there was 2 ingredients listed in this document that was not on the TGA's ingredient database. That just seems an inexplicable omission.
That's right. So there's 4 lipids involved in creating the lipid nanoparticle. 2 of those lipids had never been used before. And it's interesting, I asked the head of the TGA in estimates about these lipids, and he described these lipids as the same as the lipids you'll eat in a steak or sausage at breakfast. Well, that's not true at all. One of the lipids is actually ionised, which creates its own, by definition, that's not really a lipid. Sure, phospholipids are ionised, but a lipid, in its pure sense of the word, isn't ionised at all. It's hydrophobic. So yet again, I've been misled by our own regulator about the potential risks of those lipids, which in itself is a concern. And of course, the other thing is when they manufactured this vaccine, they changed the manufacturing methodology and how they did it. And I'll have to read it out because it's on page 19. It's a bit over my head as well, but page 19, third paragraph. Several manufacturing process changes for the vaccine, including production scale, were introduced during development. The proposed commercial scale manufacturing processes, including the use of linearized plasmid DNA template for mRNA production, whereas in early development phases, PCR amplification of DNA template was used. So that then begs the question that if they've used a plasmid DNA template, how have they filtered the DNA plasma out of the actual 37-litre batches? So in the trial batches were 300 mils. The production batches were 37 litres. So I think that's a difference of about 100 times off the top of my head in terms of scale. How have they managed to filtrate those DNA plasmids out of the actual concentration, and so that it didn't get into the vials, and that's not being injected into the body as well? Now, they may have been able to do that, I don't know, but yet again, another risk that, in my view, hasn't been adequately tested before giving it to billions of people.
And indeed, page 19, unfortunately, still quite a few black boxes on that page.
Yes.
Why is this material still being redacted? Why isn't it into the public domain for discussion now?
Well, that's an excellent question. I mean, this sort of behaviour by the pharmaceutical companies, myself and a couple of other senators down here in Australia, we've tried to get the actual Pfizer contract, and the government says it's commercial in confidence. I don't think that's the case at all. I mean, if they wanted to keep the amount they paid for the vaccine commercial in confidence, I mean, I'd argue that's not okay either. But when you're talking about something that we are expected to take the government's word on that it's safe and effective, surely we should have access to all the medical data and biochemical data involved in the vaccine, and we've been denied that right. And, for example, what I've just read out to you was originally redacted. Well, yet again, why was information critical to the production of this vaccine withheld from the public?
I mean, the whole point of science is that you publish material and open it to peer review.
Absolutely. Science has to be contestable.
Yeah. And not only was this document, well, it was attempted to be hidden from the public. It was only this tenacious lady with the Freedom of Information request that got us this document.
That's right.
And even now, that it's still partly redacted. Why can't the world's scientists, statisticians, and data scientists, of which we have plenty, read this and peer review it for us? It just seems unnecessarily cryptic for some reason.
It does indeed, and it's given the large number of vaccine injuries and the rise in excess deaths across the world. I think people are entitled to know and have answers from both our health regulators and Big Pharma as to the risks of this vaccine and why they didn't warn people about this early on.
Yeah. So the Australian authorities authorised the vaccine based on this document. So this document is primarily written by the TGA and shared with Pfizer. Is that the thing? This is like a clarification of the TGA's thinking at the time.
Yeah. So this is basically the TGA's regulation document to say, well, this is how we've examined what Pfizer have given to us. It's worth noting that the TGA never examined the patient data of the actual Pfizer trial. They never went and drilled down on some granular data and actually did an audit of the Pfizer trial results. And I'm sure you've covered that in the past. But so they, for example, when Pfizer, for example, described Maddie DeGarry as just having stomach issues, the TGA never went and drilled down on those issues to find out, no, actually she's in a wheelchair and being fed through a tube. They've just taken a lot of that Pfizer data at face value, and then that of course is this is non-clinical data, and that of course would be clinical data. This is their way of saying, well, we've rubber stamped what Pfizer have given us, more or less. But interestingly enough, they rubber stamped it after highlighting a number of risks. And I don't know if they thought they never had to release this document and that it was never going to be open to scrutiny. And I'm very grateful to Nancy, the lady who actually got this document as well. And I won't list all the doctors that have helped me out with this, getting information to me. But without this information being released, we would have not had any idea just how poor the auditing and quality assurance on the production and rollout of the vaccine has been.
Yeah, we expect these national adjudication authorities to really go the extra mile to look after your safety and my safety and our kids' safety. And it appears that in the TGA example that we have in front of us here, that wasn't done. And personally, I have no reason to suspect that other countries are any better than the Australian authorities, which are normally very, very rigorous indeed.
Yeah, and I should point out, John, it's not the extra mile. It's actually their job. It's and they failed to do their job. And of course, as we know, it's here in Australia, 96% of the TGA's funding actually comes from Big Pharma fees. So there is a massive conflict of interest, and the question really needs to be asked is, should these regulatory bodies be funded by Big Pharma and what they call recouping costs, or should, we really need to split between, we need a department that approves the drugs, but then we need a separate, entirely arm's length apart, another department that reviews the people that actually review the drugs and regulate the drugs, because there is a massive conflict of interest. And I know John Skerritt is on the board of a couple of international committees that are funded by Big Pharma, so he's got another conflict of interest there. So John Skerritt, for the listeners who aren't aware, is the head of the TGA, was the head of the TGA in Australia. He's just recently resigned, but massive conflicts of interest themselves are red flags. When you try and hold the bureaucrats in the government of the day to account, they just, brush you aside as if to say it doesn't matter. And the really sad thing about this is that there's, hundreds of thousands, if not millions of people out there across the world who have been badly let down by their governments, first of all, by not properly reviewing the risks of this vaccine, and number one. Number two, in many cases, mandating that they had to get this vaccine. And then number three, those people who did get vaccinated and who have been injured and are struggling now to get compensation, both financial and proper medical support.
The thing I've never really understood about the vaccination program, especially looking back, and I think my disquiet grew at about the same time as yours, October 2021, things were becoming pretty uncomfortable at that time. Before that, we were basically taking their word for it, but if they'd released this document in 2021, then we would have been in a much better position. The question in my mind is, why did they go for mRNA vaccines and indeed adenovirus vector vaccines with the Oxford AstraZeneca vaccine, as opposed to a tried and trusted technology, given that we had a vaccine rollout that was going to, at the time it was planned to go to about 7 billion people. Why on earth would they not use something tried and tested? Why on earth would they use something novel?
That is a very good question, and I know that this has been stated on your show before with Robert Clancy. He has said that, there's this myth that it takes a lot longer to produce a protein vaccine, and, as he rightly, he'd know, right? I mean, he's one of Australia's eminent vaccinologists. They have produced protein vaccines in a matter of months in the past. It wasn't as though they needed to go there. And yet again, another question, why did they take on a novel technology that hadn't been adequately tested over the tried and true methods of, a protein vaccine? And, we come back to this, and look, I'm sure the virus existed. I'm not saying the virus didn't exist and it wasn't a risk to older people. But when you look at the healthy working age population, they had a much lower risk of the virus. And, they may still have got crook, don't get me wrong. But did we need to, when we weigh up the costs and the benefits, or the risk and reward, was it really worth risking the health of younger people in particular to take this vaccine when their risk from the virus was very low? And I should just add, this week, ATAGI, which is sort of another regulatory body, has actually admitted that for people under 30, the risk of the vaccine in regards to myocarditis is actually greater from the vaccine than what it was from the virus. So that they've actually got themselves in a big trouble now, because they haven't, they've been saying the opposite thing for the last 2 years. And there's young children, I've spoken to many of them, Faith Ranson being one of them, who've had their lives destroyed by vaccine. I mean, they can't go to school. Young Faith, she was a beautiful 16-year-old girl, and she can't go to school now. She started back at school this year after having a year off, and she struggles to get through more than a couple of hours. And there really needs to be answers, and these people need to explain why they destroyed so many lives.
Which group was it that said that the risk for the under 30s is no longer acceptable?
So it's ATAGI. So the TGA regulates, and then ATAGI, and I can't think of the acronym, what the acronym stands.
I'll find it. I'll put the link in,
It's
that's
Technical
fine.
Advisory Group for Immunisation. I think that's what it stands for. And this is another thing, right? There's so many bureaucracies in Australia that, it takes
everywhere
3 years to work out all these different organisations that you never heard of, all on the living quite well off the taxpayer dollar. And then that's the other great deflection. When you start trying to pinpoint who's responsible for this regulation, they keep pointing at the other agencies. So you often get sent going around on a circular loop. Because they keep blaming other agencies.
When the Omicron virus became predominant, and that was for most of Australia's outbreak, actually, most of Australia's pandemic was Omicron, did the government and the regulatory authorities realise Omicron was much less pathogenic than the previous variants and change their vaccination recommendations, or did they just plough on as they were before?
They didn't just plough on, they doubled down. So about the same time, and I think it was Kyle, the mountain biker, late October. Yeah. So that was when I started getting, literally the same week, I started getting injuries from young people as well. And that was a very, very important video you released that, John. You should be very proud of what you did there.
Well, Kyle should be very proud at sharing his suffering with the world.
And the vilification he's copped for just coming out. And he was injured. He was a victim, and he just, was just treated terribly. And subsequently, as it turns out, hundreds of thousands, if not millions of others have been treated the same way.
You're a mad young man. Go away. It's in your mind.
Yeah. But
terrible.
But our guys here in Australia doubled down. So we were supposed to open up at 80% vaccination rate across the country. But instead, what our state premiers did was they doubled down and told everyone to get a booster. This is when Omicron was breaking out. So, at the same time they were saying it wasn't as bad, they were telling everyone to get a booster. Children had to get vaccinated as well as teenagers. And I heard from teenagers who couldn't go to school formals because they weren't vaccinated. Students, university students, 2 or 3 years through their degree, they can't complete it because they're not vaccinated. This is just absurd, right? And you were basically locked out of society if you didn't get your
Yeah.
first 2 jabs for a vaccine which was prepared for the Alpha variant. And by this stage, we've gone through Alpha, Delta, and Omicron. So the vaccine itself was out of date. And as we pointed
Or even earlier, it was more for the Wuhan
yeah,
variant, the very
exactly.
original one.
And as
Yeah.
you know, this document shows that antibodies started to drop off after 35 days anyway.
Yeah.
Yeah, and
Yeah. I mean, I was surprised by. I was really surprised by
and
that.
that was a stronger dose, remember, because those Wistar rats and the monkeys, what were
Yeah.
they? I can't remember the type of monkeys they were, but they only weighed 10. Yeah,
McKeats.
yeah,
Yeah.
the keys. They only weighed 10 kilograms, and they were getting 3 times the dose. So
Right.
a weight to dose ratio 20 times stronger than a human, and the antibodies were dropping off after 35 days. So how many days did that last in a 70-kilogram human? Maybe 2 to 3.
Yeah.
Who knows, right? We don't know.
Yeah, yeah. We simply don't know. We haven't been told. If the work's been done, we haven't. We've not been told. So, the Australian government's made a deal recently with Moderna, as has the UK government, as has the Canadian government, and you're building a plant. I think it might be Brisbane area. I'm not sure. To produce 100 million doses of mRNA vaccines a year in Australia. Do you have any concerns about that?
Absolutely, absolutely. Because the fact that they've come out and made this commitment, it's actually in Melbourne they're going to do it.
Melbourne,
They've made this commitment, and they're it's the government, because the government's involved with this, and they're spruiking it as an announcement. It's become political, and health shouldn't be political. So the question
No.
is, and if you've got, and we know that the big pharmaceutical companies have a lot of influence over governments because of the conflict of interest with the TGA. That hasn't been resolved, and it needs to be resolved. But if the government is dropping $2 billion on helping Moderna build this plant in Melbourne, they're going to have to justify why they're spending this money. So, it creates an incentive to report on every new virus as though it's a threat to mankind, or at least overemphasize the risk of it. There's definitely incentive there, because the people who are the so-called health experts are the people who rely on the existence of these viruses to justify their own careers, right? So it becomes self-feeding. And the reality is that we have lived with viruses for thousands of years.
Always.
So, and look, don't get me wrong, especially with bacterial, and I think it's important that people note there's different levels, different types of pathogens. So you have a bacterial type of pathogen, double-stranded DNA type of pathogen, hence your smallpox. That was originally the Edward Jenner, virus that Edward Jenner found the first cure type of vaccine for. And then you have this single-stranded mRNA vaccine. mRNA virus. Which potentially mutates much faster, and coronaviruses are known to mutate very fast. So the idea that we're going to continually try and vaccinate against rapidly mutating viruses is a ridiculous thing, and especially in light of the fact that we know about immune imprinting, and that repeated vaccination, just like we all know that we shouldn't overuse antibiotics. Well, it's the same principle when it comes to vaccines. You shouldn't overuse vaccines, because you will down-regulate. Robert Clancy's touched on this many times with you, that you will eventually bring in your down-regulating antibodies, which can have catastrophic effects on the body.
And does it concern you that there's plans to produce other vaccines in the mRNA format as well? For example, influenza, there's plans to make the influenza vaccine an mRNA vaccine. I mean, do you think that could give the same autoimmune problems as the COVID mRNA vaccine?
Potentially. I mean, obviously it'll depend on the quality of the vaccine. I mean, I do think we should judge every vaccine on its own merits.
Yeah.
But given that what we've seen from the mRNA vaccine with the coronavirus, the fact of the matter is that, as we highlighted those risks before, there are a lot more risks involved with using an mRNA vaccine than there is with a protein vaccine. And of course, the other thing is we haven't touched on, which I know you've touched on before with Robert, is the fact that a flu vaccine it's a respiratory mucosal, not vaccine, sorry, a respiratory virus. It comes in through the mucosal system. So are we better off looking at nasal sprays that kill the virus in the mucosal system, rather than injecting an mRNA vaccine into your bloodstream, that won't have the same impact as something that can get to your mucosal system? And yet again, are we better off, rather than trying to treat the entire population, should we look at early treatments, whether it's other types of whatever that drug may be, that will actually deal with people when they get sick, and that, the 1% of people that get sick, rather than expose 100% of the population to all the risks that come with giving a vaccine and the repeated doses of the vaccine. Not to mention the cost. I mean, here in Australia, we spent $8 billion on vaccines. I mean, that would have built a lot of hospitals and employed a lot of nurses and doctors.
And that's for a population of what?
25 million people.
Yeah. $80 billion for 25 million people. It's
$8 billion. Sorry, $8 billion.
8 billion. Yeah. I mean, it's just an unimaginable amount of money, isn't it? It's just quite incredible.
Yeah.
So in the UK, if someone has an adverse reaction to a drug or a vaccine, we fill out something called a yellow card. In the States, I think they have something called VAERS, the Vaccine Adverse Events Reporting System. Is there a system in Australia, and are you happy with it?
Look, there is a system. It's called the DAEN database here, the TGA database here in Australia. I'm going to have to go in about 2 minutes. I've got the bells.
No, sure.
That's okay,
of course,
but I'll finish off on this. We do.
Yeah.
It's a voluntary system. It doesn't force people to report, and a lot of people that I've spoken to who are injured don't even know about it. So, because when they're given the vaccine, they're not told, well, if you get injured, come back, contact us, and we will lodge that data. But I've got a friend who's a cardiologist, for example, who had reported 3 cases of myocarditis, and the Queensland Health Department knocked it back and said these people have to go to see their GP. So there has been, in my view, what I would call deliberate interference by governments to downplay the reporting of serious injuries. So it should be mandatory. But we've got another reporting system, Ausvax, that had a much higher rate of, and they reported after 3 days. They sent text messages to everyone after 3 days, and 1% of people had to go to hospital or see a doctor after just after 3 days. And I've spoken to a lot of people who didn't see their doctor until well after 3 days. It is a real concern. And yet again, in my view, there's been deliberate downplaying of the actual vaccine and the risks by the regulatory authorities that approved it, which in itself is of concern.
Indeed.
And but anyway, look, I better go, John. Thank you.
Senator, thank you so much, and thank you for all the work you're doing. Really appreciate it.
Okay, and thanks very much for everything you've done, John. You've been one of the very few people who actually put all the risks out there on the table, and well done for sticking with it.
And you, thank you, Senator, and thank you for your time.
Yeah, thanks very much. Have a great day.
Okay, you too. Thanks. Bye.